All right, Governor Kelly, I'll turn it over to you in just a moment. Folks, I do want to let you know that we are streaming on the normal services on Governor Kelly's YouTube channel, on the Kansas Legislature's YouTube channel. And you can also find the audio to this meeting at kslegislature.org. Click up in the top right at the audio and visual button and click on live streaming. With that, Governor Kelly, I'll let you take it.
Morning, everybody. Let's get the meeting of the State Finance Council called to order. Madeline, could you take the roll?
Yes, Senator Wagle.
Here.
Senator Denning. Senator Denning.
Here.
Senator Hensley.
Here.
Senator McGinn.
Here.
Representative Reichman. Representative Reichman. Representative Hawkins.
Here.
Representative Sawyer.
Here.
Representative Waymaster.
Here.
Governor Kelly.
I'm here.
I'm not sure if Speaker Reichman is on or not. I don't see him on the list of participants, but he may be on a phone number. Speaker Reichman,
Madeline,
are you there?
Speaker Reichman is on another meeting right now.
Okay, thank you.
Thank you, Representative Hawkins. Okay, the first item on the agenda is the update on COVID. John Rolfe is here to provide an overview. John?
Hello, everybody. Wish you happy holidays and a happy new year. I know we're all excited to get to 2021, and congrats to all the people from Wichita that survived the earthquake last night there. Okay, so this one should be a shorter update. Still trying to compress 3.5 hours of calls into 5 minutes for you. I think it's still a really strong regional tool. And so as you get the chance, anybody who's watching this, if they want to watch regionally, just go to covid.ks.gov/report-outs, and they can sign up to get the email that has the dashboard for the region, the call, and any extra things. So like, for instance, this week, KDHE had some vaccine scams that they'd seen going on. We were able to attach some information around that. Just a tool in all of your toolkits as you think regionally. As we summarize it really for the state, it's interesting. The healthcare system, I'd say, is both catching its breath and holding its breath at the same time. You were sent the weekly dashboard from the Kansas Hospital Association and the materials beforehand. And a couple things that you'll see there. One, just testing was down to probably 2/3 of what it had been the past couple of weeks, and that's because of the holidays with shortened weeks and all that. Not as many people get tested. But when you flip to the third page of that, you'll see really some bright spots out there. North Central, Northwest, and Southwest Kansas have all really done a good job beginning to come off that surge that we saw in November of total cases. South Central also seeing that, and we saw some easing in the Northeast and Southeast in that way, which has trickled also into the hospitals. You'll see our hospital ICU capacity there on the first page is still right in the same area. It's at 21%. Last week it was at 23%. And anticipated staffing shortages was also where it was the previous week at about 38%. But I tell you, hearing from each of the regions, the hospital systems and the overall healthcare system felt a little bit of an easing. I think they were feeling the squeeze, particularly in the major metros, Kansas City, South Central, and in the Northeast. And they felt some relief to unclog the system. Now, we've had the last 2 weeks Mission Control, which is the software company, was created by Cheyenne Mountain Software, that KDHE has helped push into our hospital systems to help with transfers. And their data, we went through it region by region. But overall for the state, 2 weeks ago, we were over 2 hours to try and find a hospital when someone was more acute or severe and needed more treatment, to find a hospital bed for them. This last week, that was down to 1 hour and 15 minutes. So you can see we're still close to the edge, but there's been some relief this week, and you could just feel that, I think, across the system. A few more bullet points for you. I'd tell you the healthcare system seems to be functioning well. Stories of them helping each other with specialized PPE needs, which generally come down to the different sizes that are needed for masks or gowns or things like that. And they're also doing a good job transferring patients up and down the system through swing beds, which means after someone is on the path to recovery, they'll move them out of some of the major hospitals back down into some of the regional or rural hospitals for their recovery, so they can create the space in the ICU beds where there's more specialized treatment. I love seeing them work together like that. But I tell you, they're still finding themselves in strange new places. Dr. Bro from Concordia, who joined us, talked about transferring a patient to Hayes by plane, which is the first time she'd seen that in 7 years. Emporia, they'd gone over capacity this past week in the ICU for a time, but were able to find the staff to get through it. And then 3 last points here. The vaccine is both a point of hope and frustration out there. They describe it as seeing a light at the end of the tunnel for the first time in this thing, which gives them a lot of energy. But we heard from several areas about particularly the long-term care facilities who are needing to get it, and the rural areas are not getting enough communication about what they need. And then as far as them catching their breath and also holding their breath, it was mentioned that 90+ million Americans traveled over the holidays, and we won't know if there's a holiday surge for 3 weeks after a holiday. There's also just a non-COVID surge this time of year with potential influenza and other issues that happen around the cold weather. So everybody's waiting to see what will happen with bated breath. 3 things that were encouraged: just the use of the emergency room. We've seen a decrease in people doing that, which had happened before, where people get scared that they'll get COVID going in. And that creates a secondary pandemic of strokes and heart attacks that people have that they don't get treated. So we need to encourage people to do that. The thought that today's choices impact tomorrow's outcomes. And the last, just as I like to share a bright spot, we had a nurse from Hutchinson that was on the call. He was talking about how much the encouragement from the community meant to him and his team. And he mentioned that someone had gotten some kids with some chalk, and in the staff entrance and exit, they just chalked a bunch of encouraging messages there for them to see as they were coming in and leaving each day. And you could just tell how much that meant. So it was great seeing someone invite kids into sharing kindness that way in Hutchinson. That's my report for this week. I'd be happy to stand for any questions.
Okay, very good. Thank you, John. Any questions for John?
Governor Kelly, this is Senator Denning. I have a question for John.
Yes, sir.
Go right ahead.
Thank you, Governor. John, I noticed that the percent positive is way off from what's reported on the KDHE website. Do you know why the hospital system isn't using the KDHE data?
Where are you seeing a percent positive on the sheet? I might be able to get that information for you. Oh, I see it there at the top of the second page. Let me get that information for you, Senator Denning. I know that part of where they're pulling the information is the teletracking data, and so that is only part of the tests that are being used, the PCR versus the antigen. But let me find out more information. I can report back on that to you next week.
Yeah, just for your own edification, antigen is not calculated in the positivity rate. They only calculate positivity based on PCR.
Mm-hmm.
But the KDHE website is 12.9 and the hospital is 22. So it's a big deviation.
Yep.
Yeah, and it's been like that for a while.
That's a great point. I'll get back to you on that next week if that works for you. It's a great question.
Yep, thank you.
And also, Governor, you'd asked about the reported COVID deaths last week. I think we're going to end up pulling that off of this dashboard. That is just the hospital deaths from the previous day, which I don't know is useful for a report like this.
Okay, thanks. Any other questions for John? Okay, thank you very much, John. This really is incredibly helpful to get this regional data in perspective. It's helpful as we go along. Okay, the final item on the agenda today is the review of an executive order to waive the waiting week requirement for unemployment benefits. And I've got Clay Britton, General Counsel, here to provide an overview and answer any questions anybody might have. Clay.
All right, thank you, Governor. This is Clay Britton again. Council, we're here to review an executive order under the provision of House Bill 2016 that requires that review after an emergency executive order is issued. This EO is really just an extension of a provision that was contained in a previous executive order from back in the spring, as well as a provision of House Bill 2016. A little background, as you know, the CARES Act back in the spring offered federal funding for unemployment benefits for what most states call the waiting week period, which is just an initial week that you have to wait before you start getting your UI benefits. To take advantage of that federal funding under the CARES Act, states like Kansas that had prohibited those benefits for that week had to change their laws to allow those benefits to be paid. So that is what was initially done in March through an executive order. That was Executive Order 2017. And then when the legislature enacted House Bill 2016 in the special session, it incorporated and extended that provision out through to December 26th, because the CARES Act funding for that waiting week benefit was set to expire on December 26th. As we all know, the new federal stimulus package is now in effect, and it extends that federal funding for waiting week benefits out through, I think, sometime late in March, with possibilities for extension beyond that. So this EO just continues to extend that suspension of the waiting week requirement so that we can continue to take advantage of what is now a 50% federal funding match for those benefits. It'll expire either when the governor rescinds it or when the state of disaster emergency expires, or if things change on the federal level, we can review it at that time. I think those are the highlights, and I'm happy to answer any questions.
Okay, any questions for Clay?
Governor Kelly, this is Denning. I have a quick question for Clay.
Go right ahead.
Clay, when we left session, we extended the benefits by 10 weeks. I think Kansas is 16 and we added a 10. Can you remember when that 10 expires?
That's a great question, Senator Denning. I don't know off the top of my head, but I can take a quick look at House Bill 2016 and maybe get back to you offline if that's okay.
Yeah, that would be fine. And then the other question is, not having that 1 week waiting period, do you think that's adding to the fraud activity?
Senator Denning, I don't have any indication from my discussions with Department of Labor folks and others that is a significant factor in the fraud activity. That's something we can look into a little bit more deeply if we need to with KDOL. I know that they're constantly sort of assessing where some of those problems are arising, but I have not heard that this is part of that problem.
Right. And then my final question, when we had everybody on furlough, when we were out of PPE and we shut everything down, one of the requirements that we put in is that the folks that were furloughed did not have to seek employment. We waived that. Now that we're back at work, masked up, but working, is that requirement now reinstored? That is to say, do folks getting unemployment, are they required to search for work?
Senator Denning, I know that was initially a provision in that Executive Order 2017 from back in March, and that obviously has expired. I could not say with absolute certainty whether anything in House Bill 2016 then extended that provision. So that's another thing I can double check on for you. But I suspect that requirement to seek work is back in place. And if it's not, it's because it was incorporated into House Bill 2016, not through an executive order at this point.
All right, thank you.
Okay, Clay, if you, when you find out the answers to those questions, could you get it out to the entire State Finance Council?
Yes.
Okay, very good. All right, that concludes the December 30th State Finance Council meeting. Do I have a motion for adjournment?
I make the motion to adjourn. Dan Hawkins.
Okay, Representative Hawkins, thank you. A second.
Denning will second.
Okay, we've got a motion and a second. All in favor?
Aye.
Aye.
Any opposed? Okay, see you next week. Happy New Year.